Hello everyone. Let's study a new chapter, drugs for psychiatric disorders. In some other textbook, this chapter is called by psychotropic drugs or psychotherapeutic drugs. The drugs for psychiatric disorders include antipsychotic drugs, antimanic drugs, and antidepressant drugs. From this slide, I think you can understand. Among these drugs, antipsychotic drugs are more important. I highlighted this in red color. Before I introduce these drugs, I also need to first introduce the background knowledge of this disease. Psychosis are mental illness which can make people lose contact with reality and may be functional or organic. Organic psychoses are caused by inherent dysfunction, brain damage, and other reasons. Psychoses usually include schizophrenia, mania, and depression. Schizophrenia are the most common form of psychosis. It affects about 1% of the world's population. Its hallmarks are delusions, hallucinations, disorganized thinking, and emotional abnormalities. The onset of schizophrenia is often during late adolescence or early adulthood. Patients with schizophrenia usually they have normal consciousness and basic normal intelligence. Only a few patients occur cognition impairment. Some patients after drug therapy they can be cured, mainly recover the normal state. But also there are some patients with schizophrenia require drug therapy for the whole life. This disease usually involves disorders of perception, thinking, affection, behavior, mentation, and cognition. All in all, this disease is a particular psychosis, and it is characterized by impaired thought process, hallucination, and withdrawal from reality. Hallucination usually exhibits auditory hallucination. Some patients have visual hallucination. But the obvious characteristic is withdrawal from reality. Based on the symptoms of schizophrenia, this disease is also subdivided into two types. Type 1. The symptoms of type 1 schizophrenia are positive symptoms, like hallucination, agitation, delusions. These symptoms are stimulant reactions of seeing eyes. Usually, type 1 schizophrenia has a good response to drug therapy, particularly with the first generation antipsychotics. But type 2 is different. Type 2 of the schizophrenia, usually the symptoms are negative. Here, this word of negative doesn't mean negative attitude. It means some symptoms like inhibitory reactions of seeing eyes. The patients often have no initiative, social withdrawal, and they reduce ability to relate to people, such as a blunted affection, attention deficit, apathy, and cognitive impairment. These negative symptoms are not as responsive to therapy, particularly with the first generation antipsychotics. So in this chapter, I cite antipsychotic drugs are more important than antimanic or antidepressant drugs. But you mainly study the first generation antipsychotic drugs. These groups of the antipsychotic drugs only are effective for the type 1 schizophrenia. Try to distinguish them. Mania. It is one common mood disorders. The patients usually show euphoria, enthusiasm. They have rapid thought and speech pattern. The patients with mania are extremely confident. They have increased motor activities, even fighting ideas, and impaired judgment. When I was internship in the psychiatric hospital, I had met a patient with mania. He was a young guy. He said he was the king of the Tang Dynasty, Li Shimin. Maybe you don't know. Li Shimin was the first king of the Tang Dynasty about China. Actually, maybe you know, Tang Dynasty, it is the greatest dynasty in the Asian China. He said he was the king. He was Li Shimin. He extremely confident. He said he had ability to save the whole world. Yeah, he has mania. He spoke a lot, and he had a very rapid thoughts without any pause during his speech. This disease, mania, usually the patient has episodic cause. After episode of mania, the patient usually has had intermittent remission period. They seem normal. Some patients also have biphasic disorder. In some period, the patients show mania. Another period, the patients show depression. Maybe this biphasic disorder. And some patients just show depression. The patients with depression, the symptoms usually means the intense feeling of sadness, often feel guilty. Without obvious reason, they felt guilty. The inability to experience pleasure in your activity, even change in sleep patterns and appetite, and loss of energy. Yeah, when I taught you sedative and hypnotics, I mentioned once some patients have serious anxiety and then they have serious insomnia, usually the final result, their disease developed into depression. And the patients with depression usually have hopelessness and suicidal thoughts. Suicide is the ending of the patients with depression. Okay. However, either of two extremes of mood disorders may be accompanied by psychosis with disordered thought and delusional perception. The drugs used to treat these different mental disorders, so they are subdivided into three classes. Antipsychotic drugs means these drugs usually used to treat schizophrenia. And just now I mentioned antipsychotic drugs On the basis of the drug development, they are divided into two groups, first generation or second generation. First generation also called by typical antipsychotic drugs. Second generation antipsychotics also means atypical antipsychotic drugs. Now try to distinguish them. Usually, first generation of antipsychotics are effective for the type 1. To relieve the positive symptoms of schizophrenia, they are effective. But for type 2, first generation antipsychotics are invalid. Anti-manic drugs they are used to treat mania. Antidepressant drugs used to treat depression. Okay, now maybe you want to know, why do the patients have schizophrenia? What are the antipsychotic drugs? Let's go on. Why do the patients have schizophrenia? Actually, the real cause for schizophrenia is still unclear, but we have several hypotheses partly explain why the drugs are effective. One important hypothesis is dopamine hypothesis. Actually, schizophrenia has a strong genetic component and it probably reflects some fundamental biochemical abnormalities, probably a dysfunction of the mesolimbic or mesocortical dopaminergic neuronal pathway. In the brain of schizophrenics, dopamine overactivity are founded. The agents like levodopa and antidepressant drugs, they can increase dopamine level in the brain tissue. These agents can cause psychotic symptoms and worsen the symptoms of schizophrenia. Do you still remember levodopa? The adverse effect on the seeing eyes usually include 3 points. Hyperkinesia, fluctuation, and mental disorders, all caused by behavior effects. Some patients, after using levodopa, they show some symptoms like schizophrenia, psychotic symptoms. So, levodopa, it supplies dopamine for the brain tissue. So, in the body of the patients, in their seeing eyes, maybe dopaminergic nerve functions is relatively overexcited maybe, so show some psychotic symptoms. So this is dopamine hypothesis. And all the drugs used in the treatment of schizophrenia, they lower dopamine activity in the brain while blocking dopamine receptors. So this evidence supports this hypothesis. Dopaminergic pathways in the seeing eyes, it mainly include 4 pathways. Mesolimbic pathway. Dopaminergic function. Here, it is related to emotion and affection. Mesocortical pathway. It is related to cognition, sensation, senses, and reasoning. The patients with schizophrenia, they usually have a problem in these 2 pathways. So they will show psychoactivity. Here, dopamine receptor is D2-like receptor. We usually call this is D2-like receptor. So the activity of The 2-like receptors increased, especially dopamine 4 receptor activity is increased, then the patients will show the symptoms of psychosis. Another important pathway is nigrostriatal pathway. This pathway, dopaminergic neurons in combined with cholinergic neurons, they coordinate the movement of the muscles. So here, the receptor subtype is dopamine 1 and dopamine 2-like. This is related to the extrapyramidal reactions. When this dopaminergic function is increased, the patients will show chloroform movement. When dopaminergic function is decreased, the patients will show symptoms like PD. You have studied last time. Here, the subtype of dopamine receptor, mainly dopamine 2 and 3 receptor. Another pathway is related to the endocrine system in the tuberoinfundibular pathway, mammotrophic. Here, the receptor is the 2-like receptor. It will affect many endocrine hormones release. So here, I should explain about the subtype of receptors, dopamine receptors. Nowadays, the receptors type usually include 5 subtypes: dopamine 1, 2, 3, 4, 5. But before, this subtype of the dopamine receptors classified by 5 groups. It was just discovered 2 types, dopamine 1 and dopamine 2. But nowadays, there are 5. So how to distinguish them? Here, you should understand. In some textbook, maybe you'll meet dopamine 1-like or dopamine 2-like. Actually, dopamine 1-like means dopamine 1 and dopamine 5 receptors. And dopamine 2, 3, and 4 receptors. They also caused by dopamine 2-like receptors. So here, please try to distinguish them. In these 2 pathways related to psychosis, the subtype of receptor is dopamine 2, 3, and 5, especially dopamine 2, 3, 4, especially dopamine 4 receptor. And in the substantial nigrous striatum, this pathway, it mainly means dopamine 2, 3, and including dopamine 1. Dopamine 4 is relatively less, mainly include 2 and 3. So here, if some drug can selectively block subtype of dopamine 4 receptor, maybe it has relatively less effect on this nigrostriatum pathway. And you know, many agents of dopamine receptor blockers, they have less selectivity to this subtype of receptors of dopamine. So, when they used to treat psychosis, they usually induce adverse effect related to nigrostriatal pathway and tuberoinfundibular pathway. So they induce extrapyramidal reactions and disorders of endocrine system. And in the CNS, there is another zone, chemoreceptor trigger zone. Here, it also locates dopamine 2-like receptor. This receptor activated. Once it is activated, it often induces emesis, vomit. So it is related to emetic action. So here, antipsychotic drugs basically block dopamine receptor, including this receptor. So they can be used to inhibit emesis. Yeah. Remember this. Another hypothesis is serotonin hypothesis. Because some atypical antipsychotic drugs, this means second-generation antipsychotics, compared with first-generation antipsychotics, they have low incidence of extrapyramidal adverse reactions because they have relatively weak effect on dopamine 2-like receptor in this pathway, nigrosubstratal dopamine pathway, because they mainly block serotonin receptors. So, the mechanisms of antipsychotic drugs action based on these two mechanisms. Blockade of dopaminergic receptors, because mostly they can block postsynaptic dopamine receptor in the mesolimbic and the mesocortical areas in the brain. And some atypical antipsychotic drugs can block serotonin receptors. They have low affinity to block dopamine 2 receptors. They produce therapeutic effects by blocking serotonin receptors. Okay, look at the classification of antipsychotic drugs. So here maybe you know. Antipsychotic drugs are divided into two big families: first generation and second generation antipsychotic drugs. The first generation antipsychotic drugs, also called by typical drugs, they were discovered first. Based on the different chemical structure, first generation antipsychotic drugs include phencyclidines, salsicines, butyrophenones. These are three groups, and phencyclidines are more important than the others in this chapter, especially chlorpromazine. We considered chlorpromazine as the representative drugs in this family. Salsicine, it is the representative in this group, and haloperidol is the representative in this group. And these typical drugs completely block dopamine 2 receptors, more likely to be associated with movement disorders known as extrapyramidal symptoms, EPIs. Okay. What are the pharmacological effects of chlorpromazine? Just now I mentioned this agent. It is the representative agent in the phencyclidines. How about the mechanisms of its action? In the previous sections, I mainly introduced the symptoms of psychosis in different forms. And I also introduced the hypothesis, dopamine hypothesis on the serotonin, and the drug action mechanisms. Here, let's study the typical antipsychotic drugs. I said, chlorpromazine, it is the representative drug of phencyclidines. It is the first generation antipsychotic drugs. In Chinese, it's named 氯丙嗪. It has another name in English, wintermine. I think you know this word winter, the fourth season in the year, wintermine. Based on this name, it means this drug can induce this situation like animal hibernation, artificial hibernation. After synthesis of clofazimine in 1950s, this drug was used to enhance the anesthetic effect of anesthetics because they has sedation on the seeing eyes and even induce the situation like hibernation. In about 1952, a physician in France used clofazimine for the patients with mania, and then it was discovered unexpectedly. This drug was effective to control the symptoms of schizophrenia, and it controlled the symptoms of agitation or overexcitement. It also controlled the symptoms of schizophrenia. So, since that, this drug was used to treat schizophrenia. Now, let's study this drug. Its pharmacological effects and mechanisms mainly determined by blockade of dopamine receptor and alpha, even serotonin and histamine 1 receptors. Here, this drug, blockade of the receptors, has relatively less specificity. Not only blockade of dopamine receptor, it also blocks alpha, serotonin, and histamine 1 receptor. So based on this blockade of the receptors, clofazimine has many effects, including effects on CNS, ANS, and endocrine system. Let's study one by one. The pharmacological effects on CNS. The first one is antipsychotic action. This drug possesses calming effect and lower spontaneous physical movement for the patients with psychosis. It can induce a slow in response to external stimuli. The patients after administration have drowsiness, less agitated, and aggressive and impulsive behaviors gradually psychotic tend to disappear. And when this drug used for the people without psychosis, normal subjects, this drug have sedative and anti-anxiety effects. After using clofazimine, the normal people without schizophrenia, they usually are easy to fall asleep. But this sedation caused by clofazimine is different from that of benzodiazepines. It is readily to wake up. The patients from sleep are readily waked up. And if the environment is relatively quiet, it also is readily to fall asleep again. And after waking up from sleep, the patients used clofazimine usually has normal cognition, consciousness. Yeah. This is different from benzodiazepines. But although this drug has anti-anxiety effects because of blockade of dopamine receptor, even alpha and other receptors, they are not used for anxiety of normal person because of its adverse effects. But in the treatment of the schizophrenia, usually it is just effective to control the positive symptoms, like this antipsychotic drugs, like others, glucosamine can reduce hallucinations, delusions associated with schizophrenia, known as positive symptoms, by blocking dopamine 2 receptors in the mesolimbic system of the brain. But the negative symptoms, such as blunted affect, apathy, and impaired attention, as well as cognitive impairment, these negative effects and negative symptoms are not as responsive to chlorpromazine therapy. Second effect on seeing eyes is anti-emetic effects. When chlorpromazine used at lower dose, it blocks central dopamine 2 receptor in the CTZ of medulla. So it can inhibit the nausea and emesis induced by apomorphine. Yeah, apomorphine is similar to morphine. Next time you will study morphine. It often can induce emesis. And apomorphine usually used for some animal experiment to induce emesis in the medical research. When chlorpromazine used in relatively higher dose, it has direct repression on vomiting center. So the emesis caused by other drugs or stimuli by acting on the nodose ganglia or locally on the GI tract, it is not antagonized by antipsychotic drugs. So it is invalid for emesis induced by vestibular stimulation. So it just used for the emesis caused by some effect on the seeing eyes, like morphine. It also can inhibit regulation error of hiccup center. This hiccup center, it is very close to the vomiting center. So it also can be inhibited by chlorpromazine. On the seeing eyes, chlorpromazine also has effect on body temperature regulation because it can inhibit hypothalamic temperature regulation center. So change the body temperature varying with the environment temperature. When the body temperature is lower than the environment temperature, it can increase the body temperature. So it can change the body temperature to the temperature at the same as the environment temperature. So here, I think you can understand for the patients with the schizophrenia, when they choose chlorpromazine to treat, especially in summer, hot days, pay more attention to their body temperature. Maybe it will induce sunstroke. Understand? Because this drug can increase body temperature. Yeah. It also used to induce hypothermia by lowering the ambient temperature. So for the hypothermia, hypothermic anesthesia, it is useful. Now look at this figure. Next week, you will study aspirin. This drug usually used to treat fever in the normal in our daily life, like other preparations similar to the aspirin. They are often used to treat fever, to relieve fever. But actually, because chlorpromazine cannot, it of course it is related to the adverse effect caused by chlorpromazine. It also because this drug can alter the body temperature. Sometimes it can decrease, also can increase. When it can with the physical cooling, chlorpromazine can decrease the normal body temperature even to 32 Celsius degree. When the environment temperature is relatively higher than the normal body temperature, it even can increase the body temperature. But aspirin just can lower the higher body temperature to the normal state. If the body temperature recovers to the normal state, aspirin cannot further decrease the temperature of the body. Are you clear? So the effects of chlorpromazine on body temperature is related to environment temperature. The first effect on the CNS is chlorpromazine has potentiation of other central depressive agents. It can potentiate the effects of sedative, analgesics, general anesthetics. These drugs, sedatives like benzodiazepines, analgesics like morphine, general anesthetics, these drugs all has inhibitory effect on the CNS. They can induce sedation. When these drugs used in combination with chlorpromazine, the inhibitory effects caused by these drugs can be enhanced by chlorpromazine. And these effects in CNS are all based on blockade of dopamine 2-like receptor in different pathways of CNS. Chlorpromazine also has effect on autonomic nerve systems because it also can block alpha receptor. Alpha receptor locates in many smooth muscle, especially blood vessels. Once alpha receptor in blood vessels is blocked by some agent, it will induce vasodilation. So chlorpromazine, similar to phentolamine, remember? Alpha receptor blockers. It can reverse the pressor effect of epinephrine. Do you still remember reversal of epinephrine? It just caused by alpha receptor blockers. Here, chlorpromazine also is one alpha receptor blockers. It also can induce epinephrine reversal. So the adverse effect caused by chlorpromazine includes hypotension. So this hypotension, once some patients have this problem, hypotension caused by chlorpromazine, can you guys which drug is useful to convert this hypotension to normal state? Yeah, so alpha receptor agonist, non-epinephrine can use to control this hypotension induced by chlorpromazine. Remember that? Atropine-like property because chlorpromazine also blocks M receptor in the peripheral tissue, so it has peripheral cholinergic blocking activity. Try to remember M receptor antagonist. Try to think of that drug, atropine, When chlorpromazine used at relatively large dose, it often induces blurred vision or dry mouth, dry skin, even constipation in the GI tract. Remember that? Similar to atropine. So we call this prefer cholinergic blocking activity by atropine-like property. It is caused by blockade of M receptor by chlorpromazine. This drug also can antagonize the serotonin receptors and the histamine 1 receptors, and these results also contribute to the antipsychotic effects and the sedation in seeing eyes. In endocrine system, it is innervated by a tuberous fundibular dopaminergic pathway. So chlorpromazine, because it has less selectivity to the subtype of dopamine receptors, it can antagonize dopamine 2 receptor in mammatrophic cells in the anterior pituitary. So prolactin release relatively increased. Maybe it can induce lactation. It also inhibits corticotrophin, so promote the hormone releasing hormone release. Finally, the glucocorticoids release is reduced. And chlorpromazine also inhibits gonadotropin, releasing hormone release. So these two hormones for the woman, follicle stimulating hormone and laparoscopic hepatectomy, this release also decreased. So in the woman, it can induce menstrual disorder and delayed ovulation. It also can inhibit growth hormone secretion. So maybe it can be used to treat gigantism. This is caused by growth hormone released too much. Okay, so the pharmacological effects of chlorpromazine include effects on seeing eyes, antipsychotic action for the normal subjects. It is a sedative effect. It also has anti-emetic effect and inhibit hiccup effects on body temperature regulation. This is related to the environment temperature. It can be increased, also can be decreased. It also has potentiation of other central depressive agents. And mostly these effects are related to blockade of dopamine receptor in the different pathways of seeing eyes, and partly related to histamine 1 and serotonin receptor blockade. Act on this ANS, maybe it can induce hypotension and atropine-like properties. These all contribute to adverse effects caused by chlorpromazine because it can block alpha and M receptor. Chlorpromazine has effects on endocrine system. It can induce lactation, menstrual disorder, and delayed ovulation because it can block dopamine receptor of hypothalamus in the tuberoinfundibular pathway. Okay, that's all for this section. So based on the pharmacological effect, I think maybe you can guess what disease we can use chlorpromazine. Go to study next section.